My name is Kimberly, and I am a senior BSN student and Spanish minor. I am bilingual in Spanish and have studied in Guadalajara, Mexico, and Nerja, Spain. I have witnessed the benefit of being able to greet and involve non-English speaking patients in their own care, and believe that all healthcare workers should be able to greet patients in other languages. This video is to teach you how to greet and explain what you are going to do during a general assessment of a Spanish-speaking patient. This is not a complete Spanish instruction, but rather just the beginning video to aid in the practice of more culturally competent care in the hospital. Culturally competent care is mandated by the Nursing Code of Ethics and improves patient outcomes when practiced. First, you will watch the greeting of a Hispanic patient, and then I will go into more detail and explain what you have heard. Hi, I'm going to be your nurse today.
No English.
Oh, ¿hablas español?
Sí, español, por favor.
Me llamo Kimberly. Voy a ser tu enfermera hoy. ¿Cómo te llamas?
Arturo.
Arturo. Ok, voy a hacer una examinación.
Gracias.
Voy a tomar la presión.
Muy bien.
Abre la boca. Cierra la boca. ¿Tienes dolor?
Sí, mucho.
Mucho. Muéstrame el número de tu dolor. Del 0 es ningún dolor y 10 es un dolor insoportable.
9.
¿Dónde está el dolor?
Aquí.
¿Quieres medicamento?
Sí, por favor. Nuevo.
Ok. Regreso con tu medicamento.
Gracias.
Spanish has two forms of communication to communicate you. The more informal version, or the to version, or the more formal or stead version. For the purpose of this communication, the informal to version will be used since it is appropriate for nurses to use this version to communicate with their patients. If you have a patient who does not speak in English, but you are not sure if they speak Spanish, you can ask the question, ¿Hablas español?, which means, do you speak Spanish? They will respond sí for yes, or no if they do not. If your patient speaks Spanish as our patient does, you may introduce yourself. You would do this saying me llamo and your name. For example, me llamo Kimberly. Voy a ser tu enfermera hoy. I will be your nurse today. I introduce myself as a nurse, which is the word for enfermera. If you were a male nurse, you would use enfermero. Or if you were a female doctor, you would use doctora. Or a male doctor, you would use doctor and substitute these words for enfermera. For example, voy a ser tu doctor hoy if I was a male doctor. Another way to be more specific for student nurses, you could say, soy un estudiante de enfermería for males, or soy una estudiante de enfermería for females. Since we did not know our patient's name, we asked him by saying, ¿Cómo te llamas?, which means, what is your name? And he responded, me llamo Arturo, which means, my name is Arturo. If you knew your patient's name while going into your patient's room, you may greet your patient, hola Arturo, or hola and your patient's name. If you had an older patient, you may consider using señor and their last name. For example, Señor Romero, with a patient whose last name is Romero and male, or señora for females, and Señora Romero if her last name is Romero and she is a female. Voy a hacer una examinación means I am going to do an examination. Voy a tomar la presión means I am going to take your blood pressure. It is good to clue your patient into what you are doing to provide culturally competent care. When you take your patient's temperature, to tell your patient to open their mouth, say abre la boca. If your patient is not closing their mouth, such as our patient, cierra la boca means close your mouth. Another useful phrase for taking a temperature is abajo de la lengua, which means underneath your tongue. Ask the patient if they have any pain by saying, tienes dolor. Patient will respond with no for no pain, or sí mucho for yes, or yes a lot of pain. For the literate patient, you can rate 0 to 10 on a piece of paper and use this phrase. Muéstrame en escala del 0 a 10, donde 0 es ningún dolor y 10 es un dolor insoportable, el número de tu dolor. By using this phrase, your patient will point to the number of their pain, and then you can assess their pain without having to memorize the numbers in Spanish. For the illiterate patient, you can use the FACES scale provided by your hospital and say, dime cuál cara significa tu dolor, and your patient will show you their FACE scale based on what you told them. ¿Dónde está el dolor? Can be used to ask where the pain is located at, and your patient will point to where their pain is. ¿Quieres medicamento para tu dolor? Sí o no means, do you want medication for your pain? Your patient will respond with sí, yes, or no, they do not want pain medication. I use the phrase regresa con tu medicamento, which means I will return with your medication. This phrase can be used, or you may use the phrase regresa luego, which means I will return later. Now it is time for a general physical assessment. Voy a hacer un chequeo. Voy a examinar tus ojos.
Gracias.
Voy a examinar tus pulmones. Respira. Respira. Voy a examinar tu estómago.
Okay.
Voy a examinar tus pies. Now it's time for our general assessment. Voy a hacer un chequeo means I'm going to do an assessment. The primary term you will use in this section is voy a examinar, which means I will examine, and then you will insert the body part following your phrase in order to tell your patient what you will examine. Our first phrase is voy a examinar tus ojos. I will examine your eyes. Our next phrase is voy a examinar tus pulmones. I will examine your lungs. It is important to tell your patient before you do this process, since you are going to be lifting up their gown and listening to their lungs, which they may be uncomfortable with if they are not sure what you are doing prior to you explaining it. Voy a examinar tu estómago, which means I will examine your stomach. I use this phrase to examine my vowel sound. This aids in the culturally competent care for Spanish-speaking individuals by involving them in their own care. Another phrase is voy a examinar tus pies, which is I'm going to examine your feet. Thank you for watching. I hope this has helped with your ability to provide culturally competent care to Spanish-speaking patients. I encourage you to seek further Spanish education as well as other languages in order to ensure the best culturally competent care is provided.